Okay, so here we go with our technical sessions for the day. And to begin with, I invite Dr. Tarkeshwar Jain, President, Homeopathic Education Board, National Commission for Homeopathy. If I read out his achievements, I think it will be another day or so. But in a nutshell, he's the president presently, Homeopathic Education Board, a former registrar and managing secretary, PhD coordinator, Homeopathy University, Saipura, Jaipur, international advisor to Homeopathic Heritage, chief editor, the Journal of Homeopathic Universities. I think the achievements are endless. The topic which he'll be taking today for discussion will be implementation of provisions of MES 2024 in relation to hospitals, the topic of the year. So may I please request, sir, to begin the session. Dr. Anuj? Yeah.
Good afternoon once again. I request you all to please settle down. We are now going to start most vital part of this entire day, our technical sessions. I do understand, सर्दियों में चाय की बहुत importance होती है, but we are a little lagging behind than our scheduled time, so it is very important for us to start the session on time so that we can finish on time also. And I do understand many of you might be having your return journey tickets also. So we need to anyhow wind up by 5 p.m. So it's better we quickly settle down and we start our session. So as I explained in my morning lecture, that this program is mainly designed to make aware our hospital authorities about the specific provisions that we have made in our minimum essential standard, especially for hospital, and how to implement all these provisions in your hospitals effectively. That is the sequence of our entire day program. I'll be talking only about the provisions that we have made in relation to homeopathic hospital in minimum essential standard. And the lectures which will be followed by my lecture are mainly based on how to implement those functionalities in the hospital. We need certainly to improve of functionalities, as Kotecha sir has rightly pointed out, that when we are witnessing the data of hospitals, there are many lacunas in terms of even simple diagnosis, in terms of admission of the patient, what kind of patient we are admitting in our hospitals, what kind of prescription we are writing in our OPD slips. Everything is not as up to the mark which we need to have in our hospital, in our homeopathic hospital. So that is the reason why we have planned this entire day. So I'll be talking only about the specific provisions, although you all have gone through the minimum essential standards and you all know about what provisions we have already made in the regulation itself. I just give a brief about the every important point, and then the session would be followed how to implement those points. So. Can you help, please? So as you are aware, minimum essential standard 2024 has certain objectives. One of the important objective is to specify minimum essential standards for the colleges and for the hospitals, to ensure fully functional medical institution and its teaching hospital, to provide instruments, equipment, and infrastructure for staff, teaching and non-teaching. These are three important aspects for which MES is designed. Can you change the slide? It's not working. So when we come to the hospital part, hospital functionalities are majorly listed in our second schedule. First schedule of MES talks about the provisions of homeopathic colleges, what are the requirement of the various department of the colleges, number of teachers required, number of requirement in the labs, in our laboratories, in our department. The first schedule is talking mainly about the colleges, but the second schedule specifically talks about what is required in a homeopathic collegiate hospital. That is the major thing that we discuss in second schedule. So if we talk about the basic and fundamental require of any homeopathic hospital, there are a few things which are essentially required to have every homeopathic hospital. One thing is the registration from the state authority. This is something very important, and I hope every homeopathic hospital which is running in the India is already having this. If not having, then this is something essentially required. Hospital should be registered with the state authority. There should be a registration and pollution control board certificate, which is also a mandatory requirement for every homeopathic hospital. NOC from state government or union territory or local authority, this is also very important. And another important part in terms of document is that you need to have MOU with super specialty hospital for all the facilities that you are not having in your own hospital. Like if you are having ultrasonography, it's very nice, but under PCP and PNDT Act, many times it is very difficult to establish ultrasonography. So for that reason, you can go for the MOU. And such kind of things, wherever we require some specific training, some specific exposure of our student to some specific investigations also, there you need to have MOU with the super specialty hospital. So these are 4 documented requirements which every hospital need to have. These are again some important areas. We need to have adequate reception and patient waiting area. We need to have medical record management and disposal. If you know about this particular column, we have made some provision in the regulation itself that all the homeopathic records available in the hospital should be in the digitized form for the last 10 years. This change you need to do in your hospital also, that whatever requirement you are, or whatever record you are maintaining about the OPD data or IPD data, that should be in the digitized form. We have already introduced central registration system in all the hospitals. This is also a mandatory provision. Every homeopathic hospital need to have computerized central registration system. All the records that you are maintaining in your hospital should be in the digitized form. Again, we have made provision for the hard copies also. If you go to the other sections of the hospitals, we are demanding for the hard copy of records up to last 5 years. I hope everybody has gone through that provision also. This is very clearly written in the MES also, that you need to maintain hard copy of all the records for the last 5 years. Whenever our team will come to inspect you, they may demand hard copy evidences for the last 5 years. Then there is a mandatory requirement about the clinical teaching room. This is a new introduction in the MES. Every hospital need to have 4 clinical teaching room of the size of 30 square meter. This is again a mandatory requirement for every homeopathic hospital. First aid kit should always be available in the OPD of any homeopathic hospital. All records to be maintained and digitized from last 10 years. And we have reintroduced the concept of peripheral OPD. As I already told in many of my lectures, that the purpose of introducing peripheral OPD again in the hospital is that we want to improve the patient data. We want to improve the central pool of the patients in the homeopathic hospital. If your hospital is located in the remote area, and if you are not having enough number of patients in your OPD, which is an essential requirement for the clinical exposure of the students, if that number is not reaching, then you can certainly take the help of maximum 10 peripheral OPD. It can be any number that you have to decide, whether you go for the 5, whether you go for the 7 or 3, it is only up to you. But it should be in the range of 10 to 25 kilometer where your hospital is located. So this has to be made because we receive many queries that how many number of peripheral we need to have, can we establish 3, can we establish 5, maximum number is 10. Beside that, below that, you can choose your own number. This all depends upon, this is a facility for you. If your central OPD is having only 150 patients, then certainly you can take help of peripheral OPD where you can generate some patients also. And this will also give an opportunity to our student also to go in the community and to learn about the various problems that are existing in the community. So that is the reason why this concept is reintroduced. Please take use of it. Maximum number is 10, minimum up to your own choice. We need well-furnished separate dispensaries for outdoor and indoor department, and these should be located adjacent to OPD on ground floor of Collegiate Hospital. Many times we have seen many colleges which are running hospital in the first floor or second floor. We cannot say that now you change your infrastructure, but it is now desirable, at least for those institutions which are going to establish new, to run hospital at least OPD part in the ground floor itself. It is more easily accessible. Patient can easily come up. You can shift your classroom on the upper floors, but the hospital OPD should be running in the ground floor. If it is possible, is still in the given infrastructure, like if any hospital is running on the first floor or second floor, even in the current situation, if they can shift hospital to the ground floor, it would be more convenient to the patient also, and it will follow the provision of hospital also. But we do understand that to make infrastructure changes is something very difficult. So we are not forcing this over you, but if this can be done, it would be very good. Standard operating procedure for quality assurance, sufficient stock of medicine, well-equipped and updated central laboratory. Now this is an important part. All homeopathic laboratories which are available in the hospital premises should be NABL accredited. If you have not initiated this procedure, please do initiate. If you go through the regulation itself, we are talking about the NABH also, and for that also I'll come later on. But if you have not yet applied, at least in this particular year, you raise your application to NABL. I do understand that obtaining accreditation from NABL is a difficult task. It takes time also. You need to upgrade your standard also. But at least in this current year, at least you apply for that. If you have already applied for NABL, then this would also be considered a particular year. So please take note of this. If you have still not applied for NABL, please raise your application to NABL at least. Well-equipped and functioning operation theater and labor room. The details of what is required in the OT and what is required in the labor room is already placed in regulation precisely. You must follow all those requirements. Separate unit for rehabilitation, including physiotherapy and yoga in hospital premises. And physiotherapy units are already existing in the hospital, but yoga, many hospitals are following, but many are still not following. So if you have not yet established yoga department, please establish yoga department essentially in your hospital. 25 yoga mats, students to be given minimum 1 hour training once in a week. This is the mandatory requirement again, and you need to maintain register also that every student of college should be given at least 1 hour training in a week in the yoga department of hospital. Then this is again a new introduction, emergency unit. We need to have now essentially, every homeopathic hospital need to have emergency unit. The area is already specified in the regulation itself that you can consult over there. There should be a distinct entry independent of OPD main entry. It is very essential to maintaining emergency unit. There should be a clear, unhindered entry for emergency unit. It should be separate from the OPD main entry. Then there should be an easy ambulance approach with basic life support system available in the emergency unit itself. What is those basic life support system that we have already mentioned in the entire regulation? What is the requirement of the equipment requirement, drug requirement, man-force requirement? Everything is very well elaborated in the regulation itself. So please go and consult that. And it should be under the supervision of a general physician. Now the appointment of general physician is an important part of MES regulation. Earlier, many colleges are not having separate physician for the OPD management or for the emergency management. But now it is mandatory to appoint a practice of medicine qualified medical doctor in every homeopathic hospital. He should be the in charge of this particular unit. So please take note of this. If you haven't done this till time, please do it essentially. Separate emergency bed with all basic instrument and minimum essential drugs. We have already made an annexure for the Schedule K drug, which is there in the regulation itself as an annexure. You need to procure all those medicines essentially in your emergency unit. Of course, they will be dispensed, they will be utilized under the supervision of qualified doctor only. It is not the prerogative of our own doctor to prescribe those remedies. No, this is absolutely not to be done, but it has to be done under the supervision of a general MD physician. Availability of stretcher, lift and wheelchair are again important requirement for every homeopathic hospital. These are some of the registers which every hospital need to maintain: dead stock register, equipment or instrument register, indent register, chemical or solution register, breakage register, medicine store register, medicine dispensing register, and attendance register. These are the important record that you need to maintain in your hospital. Then we need to have adequate hospital staff. I hope everybody has gone through the table which is there in the MES second schedule, where we have enumerated what kind of staff is required for the hospitals running with the 25 bed, hospital with the 26 to 50 bed, and hospital with 51 to 100 bed. These three categories we have enumerated in our table, and accordingly the staff listing is done. You know who are the consultant who can be retained only on call basis, and who are the teachers or the consultants or the support staff that need to be on regular basis. So I hope everyone is well aware about the table and know what is required as per their own bed capacity. You have to decide, you have to assess your own bed capacity, and accordingly you have to retain the staff which is essentially required for any homeopathic hospital. Dietitian, physiotherapist, we need to have full-time appointment. Auxiliary staff as required, that you can decide your own self how much auxiliary staff is required, and laundry services. So these are some of the important factors which every homeopathic hospital need to have. Then this is a very significant change which is now implemented since March 2024. This one thing also I want to make clear, that MES is in force from March 2024. And the next inspections are going to schedule somewhere in the April first week or onwards, April onwards. So the colleges already had 1 year time for the implementation of these all provisions. So any college who have still not made their hospital updated as per the provision of new MES, please, you still have 2 months time, do it, because next inspection would be on the basis of exclusively on MES 2024. This I want to make it very clear. Whatever changes are being proposed in MES 2024 now would be assessed by our team of inspector April onwards. And if any deficiency is found in relation to the functionalities of the hospital, where we are relaxing, I will come on that point also. Where the relaxation is available, we will discuss about that also. But what is essentially required, and that essential requirement is majorly concerned about the functionalities of the hospital, not about the infrastructure, but about the functionality of the hospital. There we are not compromising at all. Whatever changes are being proposed, you need to adopt by March 2025, because the next inspection would be ensured on the basis of these provisions only. So please take note of this. If you are still having your college with the intake capacity of 60, then you need to have minimum number of 30 beds in your hospital. And if you are having student intake capacity in between 61 to 100, then you need to have 50 beds in your hospital. So this is something very clear now. And one more thing I have already explained many times, but I am repeating it, that now we don't have any separate provision from 61 to 100. Provisions are absolutely same. Anyone, whether they want to go for the 75 seat or 70 seat or 80 seats or 100 seat, provisions are same. There is no difference between the provisions of 61 to 100, neither in the hospital nor in the college side. And now we are not entertaining any application also for seats of 60. We have already removed all the provisions of 60 seats. Exclusively application would be made for the 100 seat. You can make application for 70 seat, 80 seat, depending on your own infrastructure. But the provisions would be applicable which are there for the 100 seats. So there is no separate provision for 60 seat or 80 seats. There is one single provision. This is only for those colleges which are already existing. If they are existing with the 60 seats, then they need to increase their bed capacity to 30. And the hospitals, colleges with 61 to 100 seats need to have 50 beds. This is about the IPD. And for OPD, you need to have, if you are running a 60 intake capacity college, you need to have 180 patients average per day. And for the student capacity, 61 to 100, 300 patients per day. This is the minimum number of OPD requirement in your OPD. And this is, as I already explained, that if your central OPD is not able to have that number of patients, then please take help of peripheral OPD. The number would be counted together with the number that you are seeing patient in the peripheral OPD also. So this is what you can do. Inpatient department, there is division of bed. This is the same that we used to have earlier. You need to have 50% beds from general medicine, 20% beds for surgery department, 20% for OBG, and 10% for pediatrics. This is the same ratio that we are maintaining. And bed occupancy also is being changed. Now, earlier it was 30%, now it is 50%. So you need to maintain a minimum of 50% bed occupancy in your hospital. Now, there are certain things, as I told you, there are certain points where we have kept leverage of 5 years, and there are certain things where we have leverage of 1 year only. And that 1 year is going to complete in March 2025. So now we are at the brim of time. Every hospital need to have application at least. There is some confusion about this. If you go to the regulation, it says you need to apply for NABH at least. Even if still you have not applied, because as sir has pointed out in his lecture also, that till now we have only 16 homeopathic hospitals which are NABH accredited. While the regulation says that every homeopathic hospital need to have at least entry level certificate from NABH within 1 year from the Gazette notification of this notification. But here there is a little leverage which you can still utilize. Regulation says that you need to apply. At least you need to apply within the 1 year of publication of notification, and you need to acquire entry level on the date, from the date of your application is being made to NABH. Is it clear to everyone? It's very simple. आपने अगर अभी तक NABH नहीं लिया है या आपने अभी तक अप्लाई नहीं किया है, तो मेरी आपसे ये दरख्वास्त है, आप उसको तुरंत अप्लाई कर दें. आपके पास जो टीम आएगी, अगर आपका अभी एंट्री लेवल नहीं भी हुआ है, तो भी आप डिनायल में नहीं जाएंगे, क्योंकि अप्लाई करने के बाद आपके पास 1 साल का टाइम है एंट्री लेवल का सर्टिफिकेट लेने के लिए. जैसा कि मुझे मालूम पड़ा है फ्रॉम द वेरियस रिसोर्सेज, मोस्ट ऑफ द हॉस्पिटल्स हैव नॉट इवन अप्लाइड. अभी हमारे पास NABH के असेसर भी हैं, एक्सपर्ट भी हैं, जो NABH के बारे में बात भी करेंगे. व्हाट आर द एसेंशियल स्टैंडर्ड फॉर ऑब्टेनिंग NABH एंट्री लेवल एक्रेडिटेशन. दे विल टॉक अबाउट दैट. And I do assure you, these are very easy parameters. Any homeopathic hospital which is running genuinely and smoothly can easily have entry level NABH accreditation. तो अगर आपने नहीं किया है, तो आप जाते ही सबसे पहला काम ये करिए कि आप एटलीस्ट अप्लाई कर दीजिए. अगर आपका एंट्री लेवल इस साल में नहीं भी होता है, तो भी आप डिनायल में ले जाएंगे. लेकिन इस साल में अगर आपने अप्लाई ही नहीं किया है, then this would be considered as a big shortcoming at part of hospital, and this may result into denial of the permission also. So please take note this sincerely, and do make application to NABH immediately while returning home, please. We need to have emergency unit within 1 year, so the time will be over by 2025 March. Legal compliance for land and construction of building. Clinical teaching room, as I told you, this is again a mandatory requirement for every homeopathic hospital. You need to have 4 clinical teaching rooms in your hospital area itself. Now, this is the leverage that we have given in terms of infrastructure. If you compare the tables of area, if you compare with the previous regulation and if you compare with the existing regulation, there is a significant difference. The earlier required area for homeopathic hospitals were 870 square meter, and now it is increased to 1370 square meter. So there is a difference of 500 square meter area in every homeopathic hospital building. But we do understand this cannot be done overnight, this cannot be done in the 1 year time also. For that purpose, we have given a leverage of 5 years for every homeopathic hospital which is existing now. सबके पास 5 साल का टाइम है अपना एरिया बढ़ाने के लिए। तो उसके प्रयास आप अभी से चालू करेंगे तभी वो 5 साल में बढ़ पाएगा। तो धीरे धीरे आप हर साल कुछ कुछ अपने डिपार्टमेंट में, अपने फंक्शनलिटीज़ में, अपने एरिया में इजाफा करिए, ताकि 5 साल का पीरियड जब आए तब तक आपके पास नए एमिएशन के प्रोविजन के अकॉर्डिंगली एरिया हो। तो ये एक इम्पॉर्टेंट आस्पेक्ट है। तो ये कुछ फीचर्स थे जो मुझे आपको बताने थे। लेकिन ये जो इंफ्रास्ट्रक्चर का जो लेवरेज है, अगर आपने टेबल देखी हो तो बाकी सब जगह पे वो अवेलेबल है, खाली 3 पॉइंट ऐसे हैं जो हमें अभी चाहिए। यानी जो एमईएस हमारा 2024 में गजट हुआ है, उसके गजट होने से लेके 1 साल के अंदर अंदर तक आपको 3 चीजें इस्टेब्लिश करनी ही करनी है। पहला है स्किल लैब, दूसरी है इमरजेंसी यूनिट, और तीसरी है 4 क्लिनिकल टीचिंग रूम। ये 3 चीजें आपको अभी जो हमारी इंस्पेक्शन टीम अप्रैल में आएगी, दे विल डेफिनेटली लुक अबाउट दैट, वो कंसिडर भी करेंगे, देखेंगे भी, और अगर ये अवेलेबल नहीं है तो दैट विल अगेन बिकम ए बेस फॉर द डिनायल ऑफ परमिशन फॉर दिस ईयर। सो प्लीज टेक केयर ऑफ दिस थिंग। और मुझे नहीं लगता कि ये कोई बहुत बड़ा रिक्वायरमेंट है। आई थिंक 120 स्क्वायर मीटर्स रिक्वायर्ड फॉर clinical teaching room, 50 square meters required for skill lab, and 40 square meters required for emergency unit. So it is not a big area. Every homeopathic hospital can do this, and please do this so that you don't face any kind of problem while issuing the permission. These are the mandatory requirement you need to take up immediately. जैसे कॉलेज में भी अगर आपको मालूम हो तो कॉलेज में भी हमने इंफ्रास्ट्रक्चर के पार्ट में 5 साल का लिवरेज दिया है, लेकिन कुछ डिपार्टमेंट ऐसे है जहाँ पे आपको इमीडिएटली करना है। जैसे रिसर्च का डिपार्टमेंट है, वो आपको इमीडिएटली इस्टेब्लिश करना है। मेडिकल एजुकेशन टेक्नोलॉजी यूनिट है, वो आपको इमीडिएटली इस्टेब्लिश करनी है। और योगा का जो डिपार्टमेंट है वो आपको इमीडिएटली इस्टेब्लिश करना है। तो ये थोड़ा आप ध्यान रख लें कि कौन सी ऐसी चीज़ें हैं एमईएस में जो आपको साल भर के अंदर अंदर करनी थी और साल भर का टाइम अब खत्म होने वाला है, तो वो, और कौन सी ऐसी चीज़ें हैं जिसके लिए आपके पास 5 साल का लेवरेज है, ये आप थोड़ा ध्यान कर लें। स्टाफ का जो पार्ट है वो फंक्शनलिटी का पार्ट है, तो वो एप्लीकेबल हो चुका है। तो जो भी स्टाफ हमने इंक्रीज किया है, चाहे वो ओपीडी के पार्ट पे हो, अस्पताल के पार्ट पे हो, या कॉलेज के पार्ट पे हो, उसको तो एसेंशियली आपको पिछले इंस्पेक्शन के जाने से पहले उसको एसेंशियली इस्टेब्लिश करना है। मेडिकल ऑफिसर्स की सैलरीज, एमएस की सैलरीज, जो सपोर्ट स्टाफ हैं हॉस्पिटल में, उन सब की सैलरी हमने स्पेसिफाई कर दी है, वो भी फंक्शनलिटी का पार्ट है। उसको भी आपको नया इंस्पेक्शन आने से पहले उसको इम्प्लीमेंट करना है। तो दीज आर सम ऑफ द इम्पॉर्टेंट पॉइंट विच आई वांटेड टू कन्वे, ऑल्दो आई नो दैट all of you have already gone through MES, so but you all might be knowing about these, but इनमें से जो ऐसी चीज़ें हैं which require more proficiency, उनके लिए हमने आज लेक्चर ऑर्गेनाइज किए हैं। जैसे एक सबसे बड़ा इंपॉर्टेंट फैक्टर कि ओपीडी कैसे बढ़ाना, या आईपीडी को कैसे एफिशिएंटली रन करना। ज़्यादातर जो हमारे अस्पताल हैं वो ओपीडी बेस्ड अस्पताल ही हैं, आईपीडी बहुत कम ही जगह जहाँ पे रेगुलरली आईपीडी चलती है, या कहीं चलता भी है तो डे केयर चलता है। तो आईपीडी को कैसे हम प्रैक्टिकली हमारे सेटअप में अडॉप्ट कर सकते हैं, इफिशिएंटली रन करते हैं, उसी के लिए हमने आज एक्सपर्ट बुलाए हैं। ओपीडी को हम कैसे अपने नंबर को बढ़ा सकते हैं, कैसे हम एक्यूट केसेस मैनेज कर सकते हैं, प्लस अस्पताल का मैनेजमेंट क्या होता है, कैसे होना चाहिए। बहुत सारी चीज़ें जो हम देखते हैं रेगुलर, जब हमारे पास इंस्पेक्शन के फीडबैक आते हैं या रिपोर्ट्स आती हैं, तो सबसे बड़ी जो प्रॉब्लम आती है वो डॉक्यूमेंटेशन की आती है। डॉक्यूमेंटेशंस आर नॉट प्रॉपर, description of cases are not proper, even the diagnoses are not proper, discharge ticket is not properly written, admission slip is not properly maintained, prescription is not as prescribed as the homeopathic requirement is there as per the principle of Organon. Many such lacunas are there. तो उस पार्ट को भी आज के हमारे जो सब्सिक्वेंट सेक्शंस हैं उनमें हम डील करेंगे। NABH एक इम्पॉर्टेंट पार्ट है, तो NABH में जो होम्योपैथी के लिए क्या रिक्वायरमेंट है, स्पेशली फॉर ऑब्टेनिंग एंट्री लेवल सर्टिफिकेट, व्हाट आर द एसेंशियल रिक्वायरमेंट, दैट विल आल्सो बी डेल्ट इन द कमिंग सेक्शन। सो आई होप थिंग्स आर वेरी क्लियर टू यू, व्हाट यू नीड टू डू in your hospital and what are the other requirements. This I think we have already explained and communicated many times to you with the Gazette regulation and with our many circular also. So I think everybody is aware about that. So thank you very much. I just wanted to give this brief insight about the provision of regulation. Thanks a lot.